Hi everyone, welcome back to my YouTube channel and today we are going to talk about Pemphigus vulgaris. So let's start our topic with introduction. Pemphigus vulgaris is a chronic life-threatening autoimmune vesiculobullous disease that is characterized by intraepithelial blister formation in skin and mucous membranes. The oral mucosa is often the first site of involvement and lesion may precede skin manifestation by months. Without treatment, the disease can be fatal due to fluid loss, infection, and electrolyte imbalance. Early diagnosis and management are therefore critical. Epidemiology of or it occurs mainly in middle-aged adults, like at the age of 40 to 60 years. It has slight female predominance. It is more common in people of Mediterranean, Jewish, and South Asian descent. Its incidence is about zero point 0.1 to 3.2 cases per million annually. Etiology and pathogenesis. First is autoimmune mechanism. Pemphigus vulgaris is caused by autoantibodies, that is immunoglobulin G, that are directed against desmoglein 3, that is found in mucosal epithelium, also desmoglein 1, that is found in skin epithelium. These desmogleins are components of desmosome, the structures that are responsible for cell to cell adhesion. And autoantibody bind this causes loss of cell adhesion, that is called acantholysis, formation of intraepithelial blisters, and fragile villi that rupture easily. Then there is genetic factors associated with Pemphigus vulgaris that include HLA-DR4 and HLA-DR14 associations, as they have strong familial pattern in some cases. Third is triggering factors for the pemphigus vulgaris that include physical trauma, drugs like penicillamine, captopril, rifamycin, and NSAIDs. Stress and viral infections are triggering factor for pemphigus vulgaris. Clinical features of pemphigus vulgaris. There may be oral lesions that are the earliest and most persistent manifestation. They are painful blisters that rapidly rupture. There are large irregular erosion on the buccal mucosa, lips, and soft palate. There is difficulty eating, drinking, and swallowing in this case. There is desquamatic gingivitis associated with pemphigus vulgaris, and lesions heal slowly without scarring. The second, there are skin lesions in Pemphigus vulgaris that are flaccid villi on the trunk, scalp, face, or extremities. The blister rupture easily, causing superficial erosions, and there is oozing, crusting, and risk of secondary infection. Then there is Nikolsky signs that is associated with Pemphigus vulgaris. That is when we apply or doctor apply gentle pressure on skin or mucosa, it causes epithelial peeling. It is highly suggestive of pemphigus. Then there are systemic symptoms associated with pemphigus vulgaris that include malaise, weakness, and dehydration that is associated with electrolyte imbalance in severe cases. Histopathology of Pemphigus vulgaris. Biopsy is essential for diagnosis, and microscopic features shows suprabasal clefting, that is split formed just above the basal layer, and acantholysis, that is separation of epithelial cells from one another, and also there is T-Zang cells that are rounded detached epithelial cells. And we can also do direct immunofluorescence shows fishnet or honeycomb pattern of immunoglobulin G and C3 between epithelial cells. And we can also do for diagnosis indirect immunofluorescence, that is to detect circulating anti-desmoglein antibodies in the blood. Diagnosis of Pemphigus vulgaris. First is essential methods that include clinical examination and biopsy plus histopathology, and also direct immunofluorescence and serum antibody titers. And then there are some additional tests that can be done for confirmation of diagnosis that include complete blood count, liver and kidney function tests before systemic therapy, and nutritional assessment can be done. Differential diagnosis of Pemphigus vulgaris. Pemphigus vulgaris must be differentiated from mucous membrane pemphigoid, that is subepithelial blister, bullous pemphigoid, and erosive lichen planus, Stevenson-Johnson syndrome, and erythema multiforme. And also from the linear immunoglobulin A disease. So it is important to differentiate the Pemphigus vulgaris from all of these things that may confused with the Pemphigus vulgaris. Management of Pemphigus vulgaris. First, we follow general principles that include early aggressive treatment that prevent mortality, and then we go for multidisciplinary care like that include rheumatologists and oral medicine specialists. And maintaining oral hygiene and management of pain is the mainstream of the treatment. We can also go for pharmacological treatment in pemphigus vulgaris that may include systemic corticosteroids, for example, prednisolone 1 to 2 mg per kg per day, and it is for the rapid relief of lesions. But there is gradual tapering once disease is controlled should be done. We can also give immunosuppressive agents that are used as steroid-sparing agents. They include azathioprine, mycophenolate mofetil, and cyclophosphamide and methotrexate. Then we can also go for biological therapy and for the pemphigus vulgaris that include rituximab, that is anti-CD20 monoclonal antibody. It is now considered as first-line therapy in many guidelines. It has dramatic reduction in disease activity. We can also go for adjunctive therapies with all of these main therapies for the pemphigus vulgaris that include intravenous immunoglobulin and plasmapheresis that is for severe refractory cases. Management of Pemphigus vulgaris further includes supportive treatment that include topical steroids for localized lesion and antiseptic mouthwash like chlorhexidine and analgesics and nutritional support. It is important to manage dehydration with this and to treat secondary infections. Antibiotics are needed. Complications of pemphigus vulgaris. First, we do is control secondary bacterial infection and dehydration. Electrolyte imbalances should be managed. Corticosteroid side effect can happen, so these should be managed. Like for example, the thing that can happen because of corticosteroids are diabetes, hypertension, and osteoporosis. It can also cause opportunistic infections from immunosuppressants, and it can rarely cause sepsis. Prognosis of pemphigus vulgaris. With modern therapy, mortality reduced from 90% to 10%, and it is chronic disease with period of remission and flare-ups. So early detection improves long-term outcomes. Conclusion of this lecture video: Pemphigus vulgaris is a serious autoimmune blistering disorder that primarily affects the oral mucosa and skin. It results from autoantibody mediated destruction of desmosome that lead to fatigue, blisters, and erosions. Timely diagnosis using biopsy and immunofluorescence along with prompt systemic therapy, especially corticosteroids and biologics, dramatically improve prognosis. Long-term follow-up and supportive care are essential to prevent complications and to maintain quality of life. And this was all about my Pemphigus vulgaris. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.